My name is Jalemba Aluvaala. I'm a pediatrician and a clinical epidemiologist. I work as a postdoctoral researcher at the Kemri Wellcome Trust Research Program in Nairobi, Kenya, and as a senior lecturer at the Department of Pediatrics at the University of Nairobi. My clinical and research interests is in the hospital care of small and sick newborns. Specifically, I look at outcomes such as mortality, particularly their variation across time and place. And linked to this, I'm also interested in scale-up of efficacious interventions and testing new interventions to improve mortality and also other clinically important outcomes such as growth, brain injury, and development. A key component of my work is supporting local quality improvement in the neonatal units within a clinical information network which runs across 24 hospitals in Kenya. Central to quality improvement in the hospital care is the conduct of clinical audits. However, previous approaches such as the maternal perinatal death and surveillance response approach has been lacking in approaches for inpatient neonatal audits. In line with this, a colleague, Dr. Muthoni Ogolla, in her doctoral work under Professor Mike English in Kenya within the our clinical information network, has developed a clinical audit guide for inpatient newborn settings and an associated training for it. In this work, she has developed approaches for problem analysis, solution identification, and implementation within Kenyan neonatal units, which is applicable to neonatal units in low and middle income countries as we scale up small and sick newborn care. In recognition of the importance of this work and its applicability in our settings, the Ministry of Health has currently adopted this as a standard of care across Kenyan neonatal units.